So in IVF, what we do is basically in a natural cycle, a woman has only one egg, and in IVF, we are trying to stimulate the eggs which come up during that cycle. So basically, what we do is we start the woman on injections, starting from the second or third day of the periods, and the injections are given in a little high dose, which stimulates the eggs. Say there are 5 eggs in one ovary and 5 in the other ovary, so we want all those 8 to 10 eggs come up, and the injections are given every day for almost 10 to 12 days depending upon the patient profile. And we do the ultrasound, transvaginal ultrasound is done, and we look at the follicles, how they are coming up. And once they are ready, we go through the vagina, like from here we go inside with a needle, and it goes inside the follicle, and we take the egg out. So all the eggs are aspirated in the tube, and then once we have the eggs, so the eggs look like this. You can say they look like they're microscopic, you can't see them with the naked eye. So once we have the eggs, then the husband is asked to give the semen sample, and this is an ICSI machine, which is a specialized microscope in which we pick up one egg and we pick up one sperm, and the sperm is injected. You can see here there's a small sperm, and this is egg is being held, and the sperm is injected into the egg. So we make sure the egg enters the sperm enters the egg, and it is fertilized. So this is how you can see, once the egg is fertilized, it starts growing like this. On day 2 we see 2 cells, on day 1 we see 2 cells, on day 2 we see 4 or 8 cells, and so it keeps growing, and on day 5 it looks like this, which is called blastocyst. Now once we have the embryos, say we have 6 or 7 embryos, so we are going to transfer only 2 or 3 at the most, not more than that. So these are the embryos. See, we pick up 2 embryos in a small catheter. This is a very small catheter in which the embryos are picked up, and we go inside the uterus and we release the embryos here. So exactly the embryos are released in the uterine cavity. So we generally prefer to transfer 2 embryos, or sometimes if the embryo quality is not very good, we transfer 3 also, hoping that at least one will stick. So because we are transferring 2 or 3 embryos, sometimes I would say there are about 20 to 25% chances that the 2 embryos grow together, and the chances of multiple pregnancy or twins are there. And once the embryos are transferred, then after 2 weeks we do the blood test to see if the embryo is implanted and the pregnancy has taken place. So this is how the IVF process is done. So approximately it takes about 2 weeks time for the eggs to be ready. And because we have to put in a needle through the vagina, it is done under a very short anesthesia, otherwise it is quite painful for the patient. So under anesthesia, patient is very comfortable and we can do the procedure easily. The other thing is, nowadays that we are doing at our clinic also, and in most of the clinics, what happens is when we are giving hormonal injections, when the follicles are releasing a lot of hormones, it can affect the uterus lining. So what we do is, in one cycle we pick up the eggs, we make the embryos and we freeze them. For 2 months we don't charge anything extra. It is just to give good results to the patients, because we want the hormone levels to come down to normal. And once the patient has bled once, in the next cycle they come, then we start preparing them, and then we do the transfer. So the transfer is a frozen transfer. So at our clinic we are doing almost 80%, 80 to 90% I would say, the transfers are frozen transfers. And we have a laser also, by which the laser shot is given on the embryo outer wall, so that it can hatch easily and it can implant. So we have all the facilities. We are trying that we give the best results to the patients, and that is how the IVF works.